Hey, welcome back. We're actually joined by Mercedes today. Welcome.
Thank you.
And we're actually talking about hip pain and pregnancy. So I wanted to give you guys some tips today on some things that I've noticed are really useful. And Mercedes has put some of them to the test.
Yep.
And share with you today how to mobilize your hip, stretch it into some good positions to get some tension off. Also, how to use the lacrosse ball, which I always find just works some of those soft tissues and can help relax things. And also train your small hip muscles. So we'll put it all together. I want to share it with you today, and we'll start step by step on how you can actually help yourself. Now, I got the spine and the nervous system, of course, and we're actually going to talk about some of those small hip muscles because oftentimes they need to wake up, right? And they don't move quite the way they should. So we'll talk about how to train those. You know, as your family corrective chiropractor, I want to consider your posture and also your spine and nervous system too. And you'll notice as you go through all the stages of pregnancy, you start to adapt. You may get into more of what we call lumbar extension as things shift forward. You may find you shift more up here. And basically, you're doing your best to accommodate as you go through the process of a baby, right? Which is awesome. So I'm going to start today with one basic stretch that I think Mercedes is going to show us, right? But start with the basic one we talked about, and then I want to do the more advanced one where you're up on the table and more or less like the pigeon pose.
Okay.
Right? Sure. So this is a really good one for getting your glutes to open up. And remember, your glutes cross your SI joint, which is going to be involved with your hip and how you move. So let's do the basic one.
Yeah. So just lifting your leg onto an elevated surface can give you some relief in your hip. You don't have to do anything more than that.
And just starting with the basic one, you may find even like you engage your left side and just tilt forward at your hips a bit.
Yeah, and you'll feel release in your
glute.
Yeah.
And then try the more advanced version where you come onto the table more.
Sure.
And with those ones, what I would focus on, 60 seconds to 2 minutes. And when you get into that position, focus on breathing and breathing out longer than you breathe in, because if you can control your breath, it really helps make things easier too.
Yeah.
So with this one, she's actually working on the right side glute, and you'll see you got your knee turned right out. And this is going to be, for those of us maybe who are a little more mobile, and the more advanced version. And again, when you're here, hang out 60 seconds, 2 minutes, focusing on your breathing. And now maybe just because your right hip's bothering you, I'd still suggest work on your left side too. So I'd go back and forth, working on both those. And you're putting together yourself a routine for the day. Now, may I borrow that?
Yep.
So with this, a lot of the time, you may find some tenderness with it. But what you got to do is work on some of your lateral hip rotators, so some of the small muscles in here, the glutes, and you're not going to be placing it on the bone, but you're going to be placing it on the soft tissue. If it's going to be on the bone, it's probably going to be really uncomfortable. So start more in the meat of your glute or higher up through here, and I'll get you to try that just against the wall there, which you can do on the floor, but I really think the value, especially if you're not getting up and down as easily, you're going to find on the wall is going to work really well. And it's going to shift over here so you can see. And you can control the weight you put against the wall. You can move your foot out more if you want to make it harder. But essentially, when you find a tender area, right? You see tender at all?
Yeah, it's all tender.
Okay, so it's all tender. So if it's some uncomfortableness through there, you find that spot, breathe into it, hang out there for 60 seconds or until it gets a little bit easier. And then you can work different areas of your glute, those small hip rotational muscles, and just another piece of your routine. So I keep that by the desk if you're still working, or keep it on your couch side, and that way when you're watching your favorite show, you can get up and do some soft tissue work on each of your glutes. Now, once we finish up with that, great tool, I highly recommend, something simple you can do on your own. We talk about how to train the small hip muscles. Because a lot of time, remember, if you don't move a joint through a range of motion, preferably every single day against resistance, it starts to become less healthy. So you can see how important movement is, whether you're pregnant or not pregnant. Now, with this, I'm going to actually have Mercedes lay on her side. So I'll get you laying on your right side. So this is going to be some simple ways to train your hip muscles, and you may even find once you get moving more, things get a little bit easier. So I want to do the clamshells. Yeah, and thinking about all through here, top of your glutes, and some of the small muscles that help control how you rotate your hip. So with this one, I get you to keep demonstrating. When you're going through the reps, 10 to 15, start with 2 sets of 10 and go from there. Now from there, I'll have you pause. So do a bit of a variation. I'll get you to straighten this leg, and now just raise it up as high as you can. Good, and back down. And again, with the side leg lift, work in that 10 to 15 rep range. My suggestion with each of these would be start with 2 sets and then progress 2 sets of 10 and then progress to 2 sets of 15. And this is part of your daily routine. So the side one, the clamshells, and then what you're actually going to do is, I need all fours, is what you're going to do is take this foot and try and kick it up to the sky.
Do you want straight leg or bend?
You can do bent leg. So bring it up. Yes, and when you come up, kick, pause, and press against my hand, and then back down. And again, what you're doing is thinking about training your glute muscles, some low back involvement, and just getting your glute muscles to fire better again. So if you retrain them better with your brain, strengthen them, a lot of times it really helps with any hip discomfort. Thank you. I appreciate that. So think about 2 sets of 10 to start, right? Advance it to 2 sets of 15. You got your lacrosse ball, some soft tissue work, and then of course putting it all together with the pigeon pose, some stretching, some mobility, and like anything, it's a consistency that's going to be key.
Yeah.
Yeah. All right, thanks for being with us.
Yeah, you're welcome. Yeah. Thanks for having me.
If you guys have any questions, please put them below or send me a DM. Of course, we got a big mission in terms of helping people understand their health. They got to function better, to be healthier, and their spine and nervous system health, and especially when it comes to key stages of growth and development, baby, pregnancy, first years of life, and I can't do it alone. So I appreciate it. If you can share the message, if you know someone who would benefit, please take a moment to share the video or grab the link directly and just share it with someone who you know would benefit. I greatly appreciate it. Otherwise, I'll see you guys soon. Bye for now.